Welcome back to my channel. Are you tired of forgetting which test goes with which glycoside? Are you struggling to remember if the Keller-Kiliani test turns pink or blue? Well, you are in the right place. In today's video, we are breaking down the chemical tests of glycosides. Let's take a quick and clear look at the chemical tests of glycosides. Chemical tests of glycosides. 1. Chemical tests for anthraquinone glycosides. Borntrager's test. Modified Borntrager's test. 2. Chemical tests for Saponin glycosides. Haemolysis Test. Foam test. 3. Chemical tests for steroid and triterpenoid glycosides. Libermann Burchard test. Salkowski Test. Antimony Trichloride test. Trichloroacetic acid test. Tetranitromethane Test. Zimmermann Test. 4. Chemical tests for cardiac glycosides. Keller-Kiliani Test. Legal test. Baljet Test. 3. 5-dinitrobenzoic acid test. 5. Chemical tests for Coumarin. Glycosides. Iron 3 chloride or ferric chloride test. Fluorescence test. 6. Chemical tests for Cyanophoric glycoside. Sodium Picrate test. 7. Chemical tests for Flavonoid. Glycosides. Ammonia test. Shinoda test. Vanillin HCl test. Chemical tests of glycosides. Glycosides are the compounds with organic molecules having attached glucose or any monooligosaccharide unit. Usually, these are crystalline or amorphous solids, optically active, soluble in water and alcohol but insoluble in organic solvents like ether, chloroform and benzene, etc. Generally, aqueous or alcoholic extracts of crude drugs are tested with specific reagents for presence of various types of glycosides. Chemical tests for anthraquinone glycosides. Borntrager's test. To 1 gm of drug, add 5 to 10 milliliters of dilute HCl, boil on water bath for 10 minutes and filter. Filtrate was extracted with carbon tetrachloride or benzene and add equal amount of ammonia solution to filtrate and shake. Formation of pink or red color in ammoniacal layer due to presence of anthraquinone moiety. Modified Borntrager's test. To 1 gm of drug, add 5 milliliters dilute HCl followed by 5 milliliters ferric chloride, 5% W.V. Boil for 10 minutes on water bath, cool and filter. Filtrate was extracted with carbon tetrachloride or benzene and add equal volume of ammonia solution. Formation of pink to red color due to presence of anthraquinone moiety. This is used C-type of anthraquinone glycosides. Chemical tests for Saponin glycosides. Haemolysis test. A drop blood on slide was mixed with few drops of AQ. Saponin solution. RBCs becomes ruptured in presence of saponins. Foam test. To 1 gm of drug, add 10 to 20 milliliters of water, shake for few minutes, formation frothing which persists for 60 to 120 s in presence of saponins. Chemical tests for steroid and triterpenoid glycosides. Libermann Burchard test. Alcoholic extract of drug was evaporated to dryness and extracted with chloroform, add few drops of acetic anhydride followed by concentrated sulfuric acid from side wall of test tube to the chloroform extract. Formation of violet to blue colored ring at the junction of two liquid, indicate the presence of steroid moiety. Antimony trichloride test. Alcoholic extract of drug was evaporated to dryness and extracted with chloroform, add saturated solution of antimony trichloride in chloroform containing 20% acetic anhydride. Formation of pink color on heating indicates presence of steroids and triterpenoids. Trichloroacetic acid test. Triterpenes on addition of saturated solution of trichloroacetic acid forms colored precipitate. Tetranitromethane test. It forms yellow color with unsaturated steroids and triterpenes. Zimmermann test. Metadinitrobenzene solution was added to the alcoholic solution of drug containing alkali. On heating it forms violet color in presence of ketosteroid. Chemical tests for cardiac glycosides. Keller-Kiliani test. To the alcoholic extract of drug, equal volume of water and 0.5 milliliters of strong lead acetate solution was added, shaked and filtered. Filtrate was extracted with equal volume of chloroform. Chloroform extract was evaporated to dryness and residue was dissolved in 3 milliliters of glacial acetic acid followed by addition of few drops of ferric chloride solution. The resultant solution was transferred to a test tube containing 2 milliliters of concentrated sulfuric acid. Reddish-brown layer is formed, which turns bluish-green after standing due to presence of digitoxis. Legal test. To the alcoholic extract of drug, equal volume of water and 0.5 milliliters of strong lead acetate solution was added, shaked and filtered. Filtrate was extracted with equal volume of chloroform and the chloroform extract was evaporated to dryness. The residue was dissolved in 2 ml of pyridine and sodium nitroprusside 2 ml was added, followed by addition of sodium hydroxide solution to make alkaline. Formation of pink color in presence of glycosides or aglycon moiety. Baljet test. Thick section of leaf of digitalis or the part of drug containing cardiac glycoside. When dipped in sodium picrate solution, it forms yellow to orange color in presence of aglycones or glycosides. 3. 5-dinitrobenzoic acid test. To the alcoholic solution of drug, few drops of sodium hydroxide followed by 2% solution of 3,5-dinitrobenzoic acid was added. Formation of pink color indicates presence of cardiac glycosides. Chemical tests for Coumarin glycosides. Ferric chloride test. To the concentrated alcoholic extract of drug, few drops of alcoholic ferric chloride solution was added. Formation of deep green color, which turned yellow on addition of concentrated nitric acid, indicates presence of coumarins. Fluorescence test. The alcoholic extract of drug was mixed with 1N sodium hydroxide solution, 1 ml each. Development of blue-green fluorescence indicates presence of coumarins. Chemical tests for Cyanophoric glycoside. Sodium picrate test. Powdered drug was moistened with water in a conical flask and few drops of concentrated sulfuric acid was added. Filter paper impregnated with sodium picrate solution followed by sodium carbonate solution was trapped on the neck of flask using cork. Formation of brick red color due to volatile hydrogen cyanide in presence of cyanophoric glycosides. Chemical tests for flavonoid glycosides. Ammonia test. Filter paper dipped in alcoholic solution of drug was exposed to ammonia vapor. Formation of yellow spot on filter paper. Shinoda test. To the alcoholic extract of drug, magnesium turning in dilute HCl was added. Formation of red color indicates the presence of flavonoids. To the alcoholic extract of drug, zinc turning in dilute HCl was added. Formation of deep red to magenta color indicates the presence of dihydroflavonoids. Vanillin HCl test. Vanillin HCl was added to the alcoholic solution of drug. Formation of pink color due to presence of flavonoids. Disclaimer. This video is created strictly for educational purposes only. The chemical reactions and tests shown here are part of academic study and should only be conducted in a well-equipped laboratory under the guidance of qualified professionals. The chemical tests for glycosides demonstrated in this content are performed in a controlled laboratory environment by trained individuals. These procedures involve the use of chemicals that may be hazardous if handled improperly. Viewers are strongly advised not to attempt these experiments at home or without proper laboratory facilities, safety equipment, and professional supervision. Always follow standard laboratory safety guidelines, including the use of gloves, lab coats, and protective eyewear. The creator is not responsible for any damage, injury, or misuse of the information provided in this video. Thank you for watching this guide to the chemical tests of glycosides. I hope this helps you ace your exams.